Hello, everyone, and thank you for joining us today on this episode. And today we're here with Dr. Nelly, and we're having a conversation with Dr. Nelly. She's a woman of so many accomplishments in the medical field. She has a few degrees that I like to get her to talk about and have a conversation with us today. She is from the Greater Toronto area in Canada, and we're just excited to have her today to talk to us. And she's going to talk to us about naturopathic medicine, homeopathic medicine, a little bit about Bowen College, the place that she attended. So I'm just going to go right in and get started and let her just start talking. So, Dr. Nelly, tell us about your experience in your education. Give us a little insight on your education and experience.
First of all, thank you, Tracy, for inviting me to the Zoom today. It's a pleasure to be with you today in the meeting. And yes, you already said about me. My name is Nelly, and I am originally medical doctor from Egypt. And in Canada here, when Canada became my home country, I realized that I need to broaden my knowledge to integrate medical practice with holistic practice. So I joined the Naturopathic College. It's called the Canadian College of Naturopathic Medicine. And at the same time, I joined the Canadian College of Homeopathic Medicine, and I graduated from both of them in 2015. And then later on, I stumbled on another fascinating modality. It's called the Bowen therapy in 2017. I feel like this modality continued to fascinate me even more. My focus is to help people um, lose weight. Like I originally, because I am a woman, I'm trying to target the women under 50 to help them lose weight and maintain it.
Mm.
So through all my practice, naturopathic medicine, homeopathic medicine, Bowen therapy, nutrition, and I am also metabolic balance coach certified. I through all this modality I learned myself a special protocol to help people lose weight because myself I lost weight size in 3 months. So through my weight loss experience, I can help guide people, especially this kind of categories, women under 50, because I know because I'm a woman like them, to help this category to lose weight and maintain it.
Wow. Very good. That sounds like a whole topic all in of itself, Dr. Nelly. We'll have to bring you at another time and just talk to us about that.
Thank
Um,
you.
so what did you learn at each college? Tell us about each college that you went to and what you learned at each college.
I give my medical training credit to my medical school in Egypt, Ain Shams University. I have attended the college for almost 7 years, and because our education there following the European curriculum, especially UK, so I give all the credit to my training to this college because school university I learned how to diagnose patients. I learned how to interact with patients. I learned how to spot the problems. This is my medical school, and when I came to Canada, I passed all my exams as well. I didn't find a difference in what I learned and what I got in my exams here. So I believe we're all on the same boat everywhere. But again, when I joined the holistic world, naturopathic medicine, I learned a lot of modalities, a lot of ways. I have a toolbox now that doesn't only have prescription. I am not a certified medical doctor in Canada, so I don't prescribe medications. So, but in my toolbox now, I have other modalities. I have herbal medicine, I have acupuncture, I have Bowen treatment, I have homeopathic medicine, I have nutrition. I have a lot of tools to help people in their journey to heal. You know, changing the lifestyle is major. I did not learn that in medical school, but I learned it in the other colleges. I learned at naturopathic college, I learned in homeopathic college, and Bowen treatment came on the top to complement this too. In addition to nutrition, I also got learned nutrition at Edison Institute of Nutrition. I did not finish yet. I am one more modality to go to become a holistic nutritionist as well.
Wow.
So through every college, it added to my knowledge. So I became an integrative practitioner who can understand the conventional way of thinking, and I understand the holistic way of thinking, and I merge the two of them for the patient care. So
Hmm.
I like the patient to be the center of care. I like helping them with all what I learned in every single school. I believe I am fortunate enough to learn the two sides of medicine to help people to the best of my ability.
Yeah, that sounds like you really had an opportunity to blend all of them and really understand the human body. One of the things I was reading up a little bit about homeopathic medicine, and I was intrigued by the state of mind. You know, it seems to be an emphasis on knowing the state of mind of the individual that you're or the patient that you have. Can you talk a little bit about that? How it's very important that you're conscious of the state of mind of that person.
Okay, first of all, I would like to explain that homeopathic medicine is not a new medicine. It was brought to world by Samuel Hahnemann. He is the father of homeopathy. He was a medical doctor, and he came up with the idea of introducing a certain material to the body to stimulate the innate ability of the body to heal itself.
Mhm.
This is the main idea of homeopathy. Why this homeopathic medicine is different? This is a very organized medicine. I would say it has special tools to identify not only the symptom that the patient have, because homeopathy do not treat the symptom. It treats the person who has the symptom. There is a big difference between the two. What I learned in medical school, when people will come to me, I treat the symptoms, or if I put my hand on the medical problem, I try to treat the medical problem. But the concept of treating the person who has the medical problem, it was another new fascinating way for me, because I am not only putting the symptom in my consideration, I put the emotional state of life. I put what make the patient the modalities, which is what, like say for example, usually people who has fever get better with cold, okay?
Mhm.
But some people who has fever get better with heat. This, according to homeopathy, is different. But if you say this to a medical doctor who said, "Oh, it doesn't make sense. How come you have fever and you get better with heat?" You know. But in homeopathy, it makes sense. So some people heat can better with cold. Some people get heat better with heat, and some also sensations. Sometimes people will have kind of sensation that accompany the symptoms that it will not make sense in the conventional medicine. Like, say, for example, they have a splinter feeling in the throat. You know, I never learned about this kind of information in medical knowledge, conventional medicine, because we only treat the patient's symptoms. When we treat the patient's symptoms, the splinter feeling, this is very specific. From the conventional medicine point of view, it will be throat pain, pain in the throat.
Mhm.
The pain could be anything, but the way to identify pain in conventional medicine is like dull, achy, throbbing, this kind of general terms. But when it becomes a very kind of sensation, that splinter feeling, or I feel a constricting pain in the root of my nose, specifically like that,
Mhm.
or I have a pain under the right eyeball.
Mhm.
This kind of information, it made sense to me after I learned homeopathic medicine. It's so detailed to the point that if two people will have headaches and they have exact symptom of headaches and they are same age, same sex, same everything, they will never have the same emotions. They will never have the same sensations. So the medicine I will prescribe to one person will not be the medicine I will prescribe to the other person. It's not Tylenol or Advil for everyone.
Yeah.
It's a very individualized treatment for that person who
Yeah.
has the symptom, which make homeopathic medicine a whole fascinating modality by itself.
Yeah. And then, thinking about the naturopathic medicine, how you blend that. And I was reading up a little bit about that, and it talked a little bit about diet and lifestyle change. So it's very important that, your diet is correct. When you see a patient and the patient comes to you with a symptom, it's very important that you know what they're consuming, right? And what their daily activities are as far as diet, exercise, even just mental relaxation and things of that nature. Can you tell me a little bit about that, if I'm on point with that at all?
Well, naturopathic medicine is a whole umbrella of modality under which you can find a lot of other modalities. But basically, uh, the first step for anyone on the healing journey is to change the lifestyle. If they take medicine or medications or supplement or anything without changing their lifestyle, they are hindering their healing process. Why I'm saying that?
Mhm.
Because our gut is the only system that we can control. You agree with me?
Say that your gut is the only system.
That we can control,
Yeah.
right?
Yeah.
We can only control what we eat and we can what we drink. We
Hmm.
cannot control our heartbeat, how it do fast or slow unless we are exercising. But
Hmm.
even though when you don't can you cannot say to your heart stop beating like that. You
Right.
cannot,
Right.
right?
Yep.
And the other systems as well. You cannot have 100% control over them,
Right.
but you have a control over what you eat and what you drink.
Hmm.
And according to what you eat and what you drink, this is what you will get in the body. If you are eating properly, clean diet, you will definitely have the consequences of this clean diet. You will have a low cholesterol, you will have a low blood sugar, you will have a well hydrated body because you drink the enough water. Okay, so nutrition is part. The lifestyle is not only nutrition, it's also sleeping.
Yeah.
You need to sleep properly. Okay, so what I mean by sleeping, some people will say, okay, I'm sleeping 8 hours a night. And I ask them one question: do you wake up in the middle of the night?
Mm.
Yes, I wake up like 3, 4 times. So then you're not sleeping 8 hours. You are sleeping, sectioned sleep,
Yeah.
adding up at the end maybe 8 hours, but it's not full 8 hours of sleep. So some people say, "Yeah, I wake up tired in the morning." Of course, because you are not sleeping well. There is other things that affecting your sleep. Nutrition affect the sleep. Nutrition affect our emotions. Nutrition affect our way of thinking. The way you eat is the way you think.
Hmm.
Okay, so mindset is also very important in the way that you are applying nutrition to your food, to your health. If you have a right mindset, you will say, this nutrition is for me to make my body feel better, to make my mood feel better. Other people have a different mindset of food.
Hmm.
I'm eating because I love food. I'm eating because I like eating this kind of food,
Yes.
regardless of their effect in the body.
Yep.
When you ask them, can you please stop eating cakes and no, I love them. Why would I stop eating them?
Right. Right.
Okay, okay, so if you don't want to stop eating them, and say for example you have high blood sugar, how you want me to help you here? You know?
Yeah. Yep.
So the mindset is very important in the way people see food. Some people see food as comfort. Eat crunchy food because they are stressed. Eat chocolate because they lack of love. Eat salt food because they are tired. Okay? So food for them is just comfort food. That though like someone is having lots of anxiety, they want to crunch on uh, popcorns or chips or food like that,
Yep.
They are
Oh,
stressed. Get a bag of chips and finish it in one sitting.
yep.
This kind of mindset is dangerous for the body. Why? Because you are using the food that will hurt you,
So
not
yeah.
will make you feel better.
Yeah.
That's why I always say instead of using food as comfort, you have to find something else to substitute the food. If you are anxious, go do meditation, go for exercise, go for a walk, calm yourself down, you
Yeah.
know.
Yeah.
If you have any emotional problem, try to put your hand on it and see what the problem is, and then we can find the replacement of food for that emotional need, you know.
Yes.
And some people use food because they love food, and they will eat and eat and eat even if they are not hungry, you know. So if you, as you see, it depends on each one mindset. They will use the food in different ways. The only successful way of using food is to have the mindset of food is only needed for me and for my body health. Like if I have a condition and I shouldn't eat certain food, I should follow that. Why? Because I will feel better if I don't do this.
Yeah, Dr. Nelly is
So
saying,
that's why,
go ahead. I'm sorry. Go ahead. I'm sorry to interrupt. Go ahead.
oh, that's okay. That's why I'm saying I will stress more and more on nutrition as my staple of treatment.
Hmm.
And to nutrition, I will add other items.
Yeah, I like the way you blend the two of them together, and I just it's just fascinated how you selected those two areas of study. But tell us a little bit about Bowen College too. I want to hear a little bit about Bowen College as well.
Okay, Bowen College is a college.
Or the Bowen
It
method, or the Bowen
Oh,
method.
Bowen Method. Okay, Bowen Method is a very fascinating modality by itself.
Hmm.
Why is that? Because I told you about homeopathy and what homeopathy does to the body. Bowen
Hmm.
therapy is also described as physical homeopathy. What it means, it resets the body to it, by applying certain moves to the body, very gentle move. It's like kind of rolling move, stimulating the fascia of the muscle. Okay, I'm stimulating the autonomic nervous system, which is a system that we have no control over. With Bowen treatment, I am able to reset the body from the anxiety mood, it's called the fight and flight mood, to
Hmm.
a more relaxation mood.
Hmm.
It's called the parasympathetic system. When I reset the body to the healing mood, okay, this is the mood that we can digest properly, we can sleep properly. Even for women who has no problem for infertility other than they are so anxious, once they calm down, they can even get pregnant. So it's the mood of healing. If you have pain, the pain will reduce because the body wanted to heal itself. If you have an anxiety, you will feel so relaxed that you want to sleep on the table. And I had this experience with so many people. People would sleep on table under my hand, and or will feel sleepy because they are so relaxed. They are able to digest their food because we only digest when we are in the healing mode, the relaxation mode. Imagine if you are going for a fight or people are going on a war.
Hmm.
These people, do you think can get hungry? I don't think so. If someone is fighting, they're only focusing in one thing, in fighting.
Yep.
So they can if they eat, they don't know if they are full or not. They cannot digest very well. They are only focused in one thing.
Mm.
But on the other side, imagine yourself sitting on the couch, relaxed, smelling the nice smell of your food, savoring the food, giving gratitude and thankfulness to the food that you are eating and then eating.
You can eat
You
all
know,
day long then. Yeah.
you can eat until you feel full. You will not eat more because
Hmm.
if you eat more, you get stomach ache. You know, on the healing mood, there is more control on eating. On the anxiety mood, people can eat on the go, can eat the all day long. They will not feel anything. They're just eating, 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 eating because eating for them is just calming their anxiety down. But
Mm.
this is people will end up gaining weight. People will end up with lots of inflammation. People will end up with pain all over their body. That's when comes Bowen treatment here. It deals with the whole body. It's not only with, for pain, it's also for pain, for anxiety or emotions, for even depressions, for even gastrointestinal problems, for respiratory problems, for digestive issues, for infertility, for everything. Because we have one body, we have a system that we want the body to heal. Any system it will be. But in addition to the basic protocol I do for everyone, I ask people or the person coming to see me, what is your concern? Some people will have shoulder pain, some people will have hip pain, some people have back pain, some people have digestive issues, some people anything. According to that, I will add other protocols to my treatment to help that specific part heal faster.
Mm. Now, you are there any areas in the United States that practice this Bowen method in the United States that you know of?
I believe so because my teacher, Manon Bolige, she
Hmm.
is the ambassador of Bowen therapy in the whole world. She
Mm.
will go to the States, she will go to Australia, she will go to Europe, she will go everywhere. And I don't know people by name in the States,
Mm-hmm.
but I can ask. I
Okay.
can check from the, I'll say
Okay.
what's called the neighborhood we have,
Yeah. The
who
community.
is doing the community we have. I can ask Bowen College.
All right.
You can tell me which state you are looking for because there is lots of states in America.
Mm-hmm.
So you can tell me which state you are searching for a Bowen therapist there, and I will try to guide you as much
I will,
as I can.
I will definitely let you know that.
Or if you come to Canada, I'm here to help you.
All right. Sounds good. One beautiful thing we have is Zoom and those things, and we could talk over the phone. Maybe you can
I
give.
cannot give you Bowen treatment over the phone. It
You
has to be in person.
sure can't do that. So, Dr. Nelly, I have another
Yeah,
question.
sure.
What inspired you to pursue your education in these fields? It just seems like a very intriguing blend. What inspired you to go after these three?
First of all, I am coming from a line of healers. My parents are physicians.
Mm,
So, growing in a home when the two parents are physicians, I think I am a second generation doctor in the family.
no choice.
And yes, no, I had a choice. But what I liked, I have seen my parents, how they interact with neighbors, with friends, with any encounter at church. You
Mhm,
know,
mhm,
sometimes my dad, after the liturgy, the priest will stop him because there is some people who wanted to see him.
mhm.
And for him, it was just he wanted to help people, and helping others became in my blood. So I started to because I have seen my parents like that. I decided from a very early age I wanted to be a healer as well. I wanted to be a physician.
Mhm,
So I studied hard to become that doctor. Okay, but
mhm,
when I studied conventional medicine, this is not what I was looking for. I learned, as I told you, I gave all my training credit to that school, but I didn't learn lifestyle. I did not learn how to help people other than with medications.
right.
I didn't learn nutrition. I did not learn lifestyle changes. And if someone is having high cholesterol and he is heavy in weight, I'll ask him to go lose weight. How
Mhm,
will I lose weight? I don't know how to help him lose weight, you know? And this is what made me look for more education to fill that void in my practice and in my mind.
mhm,
Since I was in third year of school when I was studying pharmacology, and I see most of medications are coming from plants, okay? So I would have that thinking, why don't we use those plants, those foods, instead of giving the medications, right? But I learned later on that in medication there is a meter dose that's calculated and all that. I don't, medications has its place.
yeah,
But if you open any textbook, medical textbook, you
mhm,
will see the non-pharmacological intervention first and then the pharmacological intervention.
mhm,
But because I was not trained in the way of giving non-pharmacological intervention first, I will jump to pharmacological intervention.
gotcha.
That's why I felt that I want to know more. If I want to help my people better, I have to know more. So that's why when I came to Canada and Canada became my second home, this one I got introduced to the naturopathic medicine and homeopathic medicine and everything also I learned. So after I knew all that, I felt like, when you have a sesame door and it's an open sesame and you find all the treasures behind it,
Mhm,
it's what I really felt. And I'm still learning and I'm still digging and I'm still on. I will never stop because I found my way. I found my path. I found my passion. My passion was from before is releasing people's pain and discomfort,
mhm,
helping them lose weight. Okay, but in a healthy way. I don't want to force them to do that. I want to teach them by a very baby steps. Lifestyle changes, they will continue on. They
Yeah.
will not uh, jump after I finish with them. They will not go back to their old habit again because they learned already the good habits.
Yes.
I
Dr.
myself struggled long time with trying to lose weight,
Mm-hmm.
trying to try this shakes and bars and stuff, and I lost weight, but I rebounded again because
Oh,
I did not learn the principles.
lifestyle change.
Now, yes, lifestyle changes again. When you teach people the
Yeah.
baby step of the lifestyle, this when you can confirm that these people, even if they slip, they will go back to what they learned because they felt comfortable,
Yeah.
have better energy, better sleep, they lost weight, they don't gain as fast as before, and there is a lot of advantage of lifestyle changes.
One. Dr. Nelly, can you tell me if mental health affects your physical health?
Indeed.
Uh, this is
Why I'm saying that? Because when we have a mental problem, you cannot put your hand on it until it manifests in the body.
mm,
What this means, someone is depressed. Okay, the way of the body to say that I am depressed, I am sad, I'm not feeling well. So these people will have either they sleep too long or they don't sleep at all, they eat too much or they don't eat at all,
mm,
they don't want to work, they lose their performance, and it depends on definitely the degree of that depression, right? Or the anxiety or any mental problem. The worse the issue, the more that the person is unable to work, unable to focus, they will lose, like say for example, children at school, they will get bad grades, you know.
yes.
All this is just a reflection, the performance, the symptoms in the body is just a reflection of how you feel, because you cannot put your hand on how you feel,
Mm,
but you can see how you feel.
yeah. This is
That's
important.
and also to my knowledge, what I learned, autoimmune disease is very linked to an emotion that person hates itself. The person doesn't like himself, is rejecting himself. So if a person rejects himself, the interaction of the body is the cell is rejecting itself as well.
Wow. Give me an example of that.
That's what I'm saying. Autoimmune conditions. Body is attacking itself, right?
Gotcha.
Autoimmune condition basically, regardless of what it
Hmm.
is its definition is the body is attacking itself. Autoimmune. The immune system, our immune system,
Wow.
is attacking our own self.
And it all starts
So
in the mind.
it all starts in the brain, and people don't know that.
Mm,
They don't join the two together. Sometimes it's in the subconscious. Sometimes people are unaware of it. But
mhm.
when it happened to me on many occasions, when someone came to me with autoimmune condition, I asked one question: do you love yourself? And that person burst in crying, started
Wow.
to cry. And I said, what happened? Did I say anything wrong? I said, no, you just hit the nail on its head.
You hit that
Yes,
emotion.
yes, she said, no, I don't like myself. I don't like how I look. I reject myself. So
Wow.
that's why your body is rejecting itself as well. So we need to work on this piece. And definitely we have to support the body in different ways, nutrition, supplements, and all that, homeopathics. But we have to treat the emotional part as well. Why that person really hate herself? What happened? You know? Another thing is cancer is linked to guilt feelings somehow.
Mm,
I'm not saying all are like that. I'm just saying that some emotions are linked to serious conditions. And when you put the emotion under control, you can help the body on
heal.
its process of healing. I'm not saying that every cancer patient will have guilt feeling. I'm just saying some cancer patients have guilt feeling.
Because your body has
You
the
know?
ability to heal itself if you give it that
Yeah.
opportunity. That's what I'm hearing from you.
Yes.
you've been talking
Yes.
about this
So,
homeopathic medicine, Dr. Nelly. Tell us a little bit more about what it is and how it benefits us compared to conventional medicine.
well, I'm not in a position to compare conventional medicine with anything
Okay.
because conventional medicine is our protocol of treatment according to the medical school.
Mhm.
And I am originally a medical doctor.
Good
But
answer.
I would say homeopathic medicine can complement conventional medicine, you
Mhm.
know, and help people improve better. I'm not saying is I'm not saying I would replace any medication that patients taking, but I would say that by introducing homeopathic medicine,
Mhm.
the body will interact in a way that way will make the organ function better, and this will help the medical doctor decrease the doses he is giving to his patient, or maybe at some point will tell him or will tell her you don't need the meds anymore.
Ah,
You
okay.
know, because it happened on several occasions. Like say for example, I'll give you a very simple one. Patient who has a very high weight. Okay, she is diabetic, and with the diabetic medication is not controlling her very well, so she's taking insulin injection.
Mhm.
Some patients will take as many insulin injections as long as the blood sugar is not controlled. Okay, so now let's adapt the lifestyle changes, nutrition, okay, supplement, homeopathy to this protocol of treatment of the conventional medicine. People will lose weight, their need for insulin will decrease. Okay, so initially they will not need as many insulin injections as they used to have before. So as the more they will lose weight, the more the blood sugar will get under control with the diet and the supplement and the medication they are taking. The need for insulin will decrease, the injection ones.
Mhm.
Okay, and then let's take a further step. Patient is more controlled. She stopped insulin injections. And now she can control her blood sugar with diet and supplements. Okay? So when she goes to her medical doctor find her lab work excellent. And he will start to decrease the medication.
Yes.
Maybe to a minimum dose, or maybe he will tell her you don't need the meds anymore.
Mhm.
See, this how the two should work together.
Yeah.
Okay?
Mhm.
Because we all know that medications has a side effect. We all know that.
Mhm.
But we have, and also when you eat the wrong food, it has a side effect as well. So everything should be given in the correct way.
Yeah.
Food should be eaten the correct way, so it will not have the unpleasant effect like gain weight, diarrhea, and food also has hazards, same
Yeah.
like meds. I'm just not
Mixing.
blaming meds for all our side effects, right? So
Yeah.
sometimes we inflict the side effect on ourselves. Eating too much sugar, people will have diarrhea all day long.
Yeah.
you know,
I
so it's
started thinking about as you're talking about that, and especially food. I'm thinking about different types of food mixing with each other. That can have an effect on you as well, right?
exactly, yeah. So I'm not only saying adverse effect comes from medications.
Mm-hmm.
Adverse effect can come from food when you don't eat the proper combination.
Mm-hmm.
Adverse effect it can come from supplements when you don't take the proper supplement. Like for example, one patient came and told me they have high blood pressure,
Mm.
and I asked what she take. Said, "Oh, I don't take any medications." Okay, so what supplement do you take? She showed me the supplement she was taking, and I found that um, the supplement she was taking to help her stay awake and make her, some people are taking stimulant, right? In the supplements, like coffee, if there is a coffee or coffee stimulant in the
Okay.
supplement, it will give people this kind of
Right.
awareness, right?
Mhm.
So that person doesn't drink coffee in the first place,
Shouldn't.
and she doesn't.
Oh.
Okay, so when you don't drink coffee and you take a supplement that has coffee in it or something related to coffee in it,
Mm-hmm.
your blood pressure will pop up. So especially for people who don't drink coffee, they are sensitive to coffee.
Mm.
So if you take something that your body is sensitive to, it will react. So I said, okay, you need to stop that supplement. It was a supplement, it wasn't medication. So you need to stop that supplement because that supplement is causing you to have the high blood pressure. She stopped the supplement. blood pressure went back to normal.
Yeah. You got me thinking about water, Dr. Nelly, for some reason. How important is water?
Exactly. So, as I said, like we say, medication has timing. Also, the proper supplement has its timing and the proper food.
Mm-hmm.
Some food that can be a healing for someone can be a poison for someone else,
Yes.
right?
What does water play in all of this?
Oh my God. Water is very, very, very important.
Mm.
Water is 75% of your body constitution.
75%.
75%.
Yeah.
So
Not soda, not juice, but pure water. You recommend that people consume a good percentage of water on a daily basis, right?
I would recommend filtered water, not all water,
Filtered water.
because the definition of water is it's a substance that does not have a color, does not have a smell, and does not have a taste.
Mm.
If a water has any of that, that's not a proper water. Okay, and it shouldn't. The water should be replenishing to the system.
Hmm.
So does alcohol or other drinks are actually dehydrating the cell. Why? Because they are acidic in nature.
Acidic. Okay.
Yeah, so when you take acidic drinks, you're actually dehydrating yourself.
Wow.
And um, so does we all, like, according to my nutrition knowledge, okay, according to what I learned in
Hmm.
the researches as well, sodas are actually not good for your system. Too much or too little, again, I said some people are more sensitive than others.
Mm. Okay.
Why drink soda in the first place? What is, as I, in the beginning of the conversation, we said we only consume what's good for you, right? We agreed on that.
Yes, we did.
What is the nutritional benefit of soda? What is it? I don't know. If you know, let me know. I don't know.
Do not.
I don't know what is the nutrition or the nutritional effect of sodas. Okay, other than pleasure.
Yeah.
So I
Yeah.
will not get,
Exactly. Yeah.
I'm talking from the nutritional point of view. Okay, there is no nutritional benefit out of those drinks.
Hmm.
Okay,
Hmm.
and some people will say alcohol in moderation.
Hmm. Yeah.
Fine.
Yeah.
Okay, what is your liver function to start with? We know alcohol is metabolized in the liver, right?
Hmm.
What is your liver function to start with? If you are drinking alcohol and your liver function is really bad, you need to think about it. Again,
So,
what
Doc,
is more important to you? You
and
know?
I didn't want to go too far into this conversation because we'll have to come back at some point and talk about this.
Yeah, so again, water is essential
Yeah.
compared to the other drinks.
Yeah. But I wanted to ask you about, I just lost my train of thought. Water is important. We want to make sure that we consume a lot of water. Um,
Not a lot of water though. There is a formula for water.
a formula. What is the formula for water, Dr. Nelly?
Yeah, the formula for water is half of your body weight in pounds
Ah,
is equal to the ounces of water you need per day.
so if I weighed 180 pounds, I should be drinking 60 ounces of water a day.
90.
I mean, 90 ounces. I'm thinking I should be drinking 90 ounces of water a day.
And if you want to know how many cups of water you should drink, you should divide this by 8 because 8 ounces is 1 cup of water. So 90 divided by 8, it will be around 11 glass of filtered water a day.
Filtered water. You said filtered water again. Talk to me about filtered water so people understand what that means.
Again, as I said, the definition of water is has no color, no taste, and no smell, right?
Mhm.
So if I like filtering my water, okay, the water bottles, as another instance, we don't know when this water was put in the plastic, okay. I also know that the longer the water stay in the plastic, the more the plastic will give to the water its degradation materials.
Mhm.
Again, this is something that we don't need in our system,
Right.
okay.
If it's exposed to the sun as well, I heard at one point that if
It
the
melts.
water
It
bottles,
melts in the water, and people drink that water. It has plastic in it. you
Yeah.
know.
Yeah.
So that's why I don't like drinking bottled water. I don't like drinking tap water. I like to drink filtered water.
Yeah.
And
Okay.
definitely there is a tons of filters in the market. You need to choose the filter that will remove the unnecessary product from the water and hopefully will add the minerals that was in the water in the first place, so
Hmm.
you can drink a life water.
Okay.
And another thing, some people will drink boiled water. I don't recommend boiled water as well,
Mm.
because when you boil the water, you remove all the oxygen out of the water, so it basically becomes like dead water.
Mm.
But when you heat the water is fine, but just heat it to a not to 100 degrees. Just heat it to like 50, 60 warm water. You don't need to heat the water. You don't need to kill the water and then drink it. Tea and infusion is different, because in that case you are not drinking that water, you are drinking the tea. So you
Mm.
are taking the benefit of the tea you are drinking.
Hmm.
And that's why we don't add the 11 glasses of water when you drink tea and coffee.
Right.
It's
Okay.
not included. It's not included in our calculation. This is extras.
Okay. So that's an extra liquid during the day. Okay.
Yes, because it's not the water that we want for our body. The water is for hydration.
Hmm.
Anything else you drink is additional.
Okay. All right.
Yeah.
So, Dr. Nelly, naturopathic, homeopathic, Bowen method. What do you want the world to know about these types of procedures, medicines? Um, what aspect of medicine do you enjoy? Do you enjoy the most?
I enjoy a combination of all,
Mm.
because I feel the benefit in
Hmm.
each one of them.
Mm. Okay.
They are complement each other.
Mm.
I want people to know that there is other choices out there
Hmm.
that can add to them and can help them in their healing journey. You know, you don't need to reach an end point. There is nothing working for me. You don't need to reach that point.
Hmm.
Just reach out to a holistic practitioner in addition to your medical doctor, and let them work together, because the two of them are really helping you on your healing journey
Mm.
to achieve the health you want. I always like quality of life. It doesn't matter how long I live. I want to live fine. I want to live on my feet. I want to continue walking, exercising,
Hmm.
serving myself,
Hmm.
right? It
Yes.
doesn't matter how long I live, but I'm looking for the quality of life I live.
Hmm. You want to
I
be.
don't want to be bedridden for the rest of my life. I don't want to be in a wheelchair in the rest of my life. I don't want anything of that. I just want to be healthy as long as I live.
Hmm.
And
And
I want this for everyone.
yes, and that can be controlled or somewhat controlled by the foods that you eat and
The
your
water you drink,
the water you drink, your mindset during the day, your activities, how much sleep you get. All of that plays a part. So when I go to a doctor and I'm having some sort of medical issues, I'm hoping that the doctor asks all those questions and takes the proper tests that they need to take for me so that they can diagnose my symptoms properly, right? So if I wanted to see a doctor that practiced in your field, would I go see my normal primary care physician first, get all of my blood work done, and then come see you? How would that work? How do you normally see your patients?
well, it doesn't matter really anything. You know, some people, there is no right and wrong here.
Hmm.
It's a patient preference.
Okay.
You know, it depends on what the condition is.
Hmm.
You will only go see your medical care provider, your health, like your medical doctor for
Mhm.
physical. It's once a year, right?
Yes.
Or maybe every 6 months,
Mm.
right? But and the lab work is if it depends on the state and coverage and all that. It depends on how many you are allowed to have.
Mhm.
So again, if you are going to your medical doctor for physical, it's different than if you go to your medical doctor if you have a condition, like high cholesterol, high blood pressure, diabetes, anything like that. So there is a lot of there's a lot of difference between one patient and another, and everyone is unique, everyone is different,
Mm-hmm.
and it depends on their mindset. They only want conventional treatment, or they want complementary holistic treatment as well.
Mm.
That's why I'm saying it's all about mindset, people preference, as they like, But what I'm just asking everyone is, don't wait until you feel hopeless.
Yes, that's a
If you don't see yourself going in the right direction, think about it again.
that's a great message to leave with people, Dr. Nelly.
Yes.
So, if you, what other message would you like to give to the medical field and humanity? Is there a message you'd like to give?
Well, my other hope is I want all healthcare practitioners to accept each other. We all have a different scope of practice.
Mm.
We complement each other. So I just want people to have more open mind to other healthcare professionals and work with them
Mhm.
and try to know what they have to offer.
Mhm.
Because the oath we all said when we joined, when we applied, when we finished our medical school, and we swear to do is to do no harm to our patients,
There you go.
right?
Mm.
So
Yep.
we all swear that kind of oath. Medical
Mhm.
physicians, medical MDs, medical doctors, I believe all healthcare professionals, they all agree to no harm.
Yes.
Okay, if I as a medical care provider, I feel like patients not getting any more benefit from me, I should refer them to someone else. Why I have to try to someone when I cannot give them benefit or cannot give them value, you know? Not to keep my patient, hold on them and keep them with me. I have to do whatever I can. No, it's not that.
Mhm.
The first thing that every healthcare provider should think is the patient care.
Patient.
Because we all swore that
Yep.
we are all physicians, we are all in the medical health care field to help patients, to help people live better, to help people achieve the health they are willing to have.
Mhm.
So if I feel that I cannot help them anymore, I should know where is my deficiency and refer to someone else who can help them. There's no problem with that. Patient will love me more because I care about them. Genuinely, I do care about them. I want them to feel better, regardless if they are my patient or not,
Mhm.
if
Yeah.
I can help them or not, right? So every healthcare professional had their own scope of practice, but every scope of practice is not complete. We are only complete together. That's why I wish to bridge the gap between conventional medicine and holistic medicine.
Mm.
And
Mm.
I believe with my knowledge, being the two of them, I feel I am one of many who can do this bridge or who can be that bridge.
Yeah. I would certainly say that you have the education, you have the knowledge. We just got to get you out there a lot more, Dr. Nelly, to get you some exposure to as many people as you can so that we can influence them to show them the importance of those two fields joining together. And would you say that it's also important that the patient embraces this thought process as well,
Yes.
right? So we,
Patient should be a team player in this plan of treatment. They
Mhm.
cannot only be a receiver.
Mhm.
If a patient is not willing to apply the plan of treatment, this means they are not willing to heal itself. They are
Yeah.
not willing to heal because there is no button to press to make people feel better.
Mhm.
People should share their ideas, their thoughts in their treatment plan, if it's doable for them or not doable for them.
Yeah.
They have to give us the insights about our thinking process.
Mhm.
Can they do this, or they need to make it smaller for them to start with? You know, they
Mhm.
have to be a team player with us. They cannot be passive in the plan of treatment. They have to be active. I am asking every single person to be active and take their health in their hand and say, I want to feel better today,
Mhm. Mhm.
not tomorrow. يمكن
Yeah.
yesterday.
We also should get to the point that um, we're we're not treating an illness, right? But we're taking care of ourselves. We're eating right, so that we don't have these illnesses, so that we don't have the high cholesterol, right? We want to treat the you always hear about treating the illness, right? But what happened before the illness is what the doctors should be concerned about, or what the patient should be concerned about. And we talked about this since we've been on this episode, where we talked about we're we're eating the wrong things, a bag of potato chips full of sodium, drinking the soda, drinking the unfiltered water, not sleeping enough. All of those things are important. And you even talked about how after you change your lifestyle, once you change your lifestyle and you return to the doctor does some lab work and realizes that your symptoms, your blood sugar, all of that stuff has been reduced, and they can reduce the medication that they've been giving you. Correct. So it's all about a lifestyle change, and how do we get people to change their mindsets? Not grab for that bag of chips every day, not sit in front of the TV too long. Get up and do some exercise. Establish some sort of a routine each and every day, so that you're healthy. So that I think that's what I'm hearing most of all in this conversation. But you studied that, so you know that for a fact. Am I right?
Yes, and I applied it on myself. I
Mm.
applied it on my every person I got interaction with who are willing
Mm.
to help themselves, because I interacted with some people who are not willing to be part of the treatment plan. In
Yeah,
this case, I would say, okay, if you are not willing to be part of the treatment plan, I don't think I can help.
and that's important, right?
Yes, because I cannot force a plan on them. I will not do the shopping for them. I will not do the cooking for them. I will not do the difference, any difference in the behavior they do, or anything they do wrong or right. I cannot change that for them. They have to be the one changing these things in their own life and their children's life, you know. So I am only willing to work with people who are willing to be a team player with me. I am not the boss. You are the boss. I'm not the boss.
Dr. Nelly, you couldn't have said it any better. And on that note, I think we're going to end this conversation. Would you come back and talk to us again about another topic at some other date?
Sure, Tracy, it's my pleasure always. I enjoyed the conversation with you very much. Thank you very much.
I so much enjoyed this conversation. So this is Tracy Griffin and Dr. Nelly, Griffin Wellness Solutions. We're going to close this episode of Conversation with Dr. Nelly. Thank you all, and have a blessed day.